Good evening, everyone. Thank you all for joining tonight. I'm Fatun Al-Khalifa. I'm a senior dental hygienist and a lecturer at the King Saud University. And also, I'm a member of the Continuing Education Committee at the Saudi Dental Hygiene Society. And in this session, I'll be the moderator. As the Saudi Dental Hygiene Society mission is to represent and support the dental hygiene professionals, the society dedicated specific sessions in this conference for research to support all professionals, including students, interns, and practitioners. So before we start, I would like to remind you that to take a moment to evaluate our speakers, and you will see the evaluation at the top of the screen. This session will include 2 research projects, and we'll start with Ms.Reem Alomair. Ms.Reem Alomair, she holds a Bachelor degree of Science in Dental Hygiene from King Saud University. She graduated this year as an honor student. She has multiple contributions in the community work as well as volunteering in many events. Today, she will present her graduation research project titled A Cross-Sectional Assessment of Knowledge Amongst Saudi Dental Clinicians on Maintenance and Complications of Oral and Perioral Piercing.
Can you hear me?
Yes, you can go ahead.
Good evening, everyone. My name is Reem Alomair, and I'm a dental hygiene graduate from King Saud University. First, me and my colleagues, we would like to express our gladness to participate in the first Saudi Dental Hygiene International Online Conference by presenting our research, which is a cross-sectional assessment of knowledge among Saudi dental clinicians on maintenance and complications of oral and perioral piercing. Before we start, we need to know, what does the piercing mean? It is a metallic accessory or jewel that punctures parts of a human body, and it's used in some cultures to reflect various implications depending on the piercing site, size, and shape. For example, it can reflect aesthetic or religious or ritual purposes. Also, it could represent belonging to a certain social group. And nowadays, piercings are popular among adolescents and young teenagers. In reference to complications, the complications can be range from local to systemic, depending on the piercing site. For local complications, we have scarring, gingival recession, diastema, teeth fracturing, and hypersensitivity. And for systemic complications, such as endocarditis, hepatitis A or B or C, herpes simplex virus, and human immune deficiency virus. So, these complications could be prevented and controlled with raising the awareness and the knowledge of the individual and dental health professionals. And regarding the literature review in Saudi Arabia showed that there is insufficient number of research conducted regarding this topic. So, the aim of this study is to assess the knowledge and maintenance and complication of oral and perioral piercing among Saudi dental clinicians. Moving to the literature review, several studies were conducted to assess the knowledge and awareness of oral and perioral piercing complications, which have resulted in lack of knowledge among the individual with the oral piercing. For the complications, there are 2 different types of complications associated with the oral piercing. We have a complication that occur immediately after the piercing, and we have a long-term complications. A study was conducted in Jazan in Saudi Arabia in 2016, reported that the swelling and the hemorrhage as a complication associated with tongue piercing. And the reason behind that is the tongue is richly supplied by blood vessels, and any damage to these vessels can cause excessive bleeding. Also, we have other studies reported that endocarditis and mastication problems considered as a long-term complication that might occur due to the oral piercing. Also, regarding the complications, it can be classified according to the type of the tissue involved. We have trauma to the hard tissue that can occur in enamel or dentine, and this trauma can lead to problematic conditions such as caries, fractured enamel, abrasion, diastema, or misaligned teeth. As we see here in the picture, there is a fracture in the upper central incisor due to the tongue piercing. And the second classification is trauma to the soft tissue that can cause a gingival recession, laceration, and tissue hyperplasia, depending on the piercing site. As it's shown here in the picture, there is a gingival recession due to the perioral piercing. Moving to the clinical care of the piercing area, it includes two things. First, we have to evaluate the piercing tightness and any evidence of infection. Also, we need to perform prophylaxis to ensure the cleanliness of this area. And for the individual maintenance, they should lightly brush the piercing and the surrounding area. And after the healing, they should replace the piercing with a smaller size. And to avoid a cross-infection, individual should avoid using contaminated hand or object on the piercing area. Also, it is equally important to avoid habits such as opening the mouth widely to reduce the risk of trauma to the teeth or gingival tissues. And for the material and methods for this study, we used the Google form to develop and deliver the study survey through the social media to Saudi dental clinicians, including dentists and dental hygienists. And the approval of the Institutional Review Board was obtained. For the survey of this study, it was consisted of 26 items, include 9 items of demographics and 5 items about the maintenance and 12 items about the complication of oral and perioral piercing. And we excluded non-Saudi dental clinicians, unemployed dental clinicians, and undergraduate student and intern. For the dependent and independent variables for this study, the independent variables are dental profession, educational background, which is private or governmental university or colleges. However, for the dependent variable is the knowledge of maintenance and complication of oral and perioral piercing. The data were analyzed in 3 levels. As we see here, descriptive, preliminary, and primary. And we use a cross-tabulation test to analyze the preliminary data. And for the primary analysis, it was 2 sections. The first section was about the relationships between the dependent and independent variable, and we used a cross-tabulation test. And for the second section, we use a 2-way ANOVA to test the hypothesis. So the study includes 2 null hypotheses. The first hypothesis is there is no statistically significant difference in maintenance knowledge of oral and perioral piercing among Saudi dental clinicians graduating from either private or governmental university or colleges. And the second hypothesis is there is no statistically significant difference in complication knowledge of oral and perioral piercing among Saudi dental clinicians graduating from either private or governmental universities. For the result of this study, the survey was completed by 179 participants, and as we see here in this figure, more than half of responses were from females. And for the age, the responses, as we see here, ranked respectively from the highest number of responses, which is 57%, and their age were between 21 to 30, and to the lowest number of responses, which is 0.6%, and their age were over 60. And regarding the region, as we see here, most of responses were from the middle, and West comes in the second place, and the lowest responses were from the North. Can you see the slide? Okay. A 76% of participants graduated from governmental, university, or colleges, whereas 24% of them graduating from private university or colleges. As you see here in this table, it shows the top 5 responses regarding the undergraduate degree were granted from. As you see here, King Saud University comes in the first place, then Riyadh Al-Ilm University, and almost as we see here, there is a close percentage between King Saud bin Abdul Aziz and King Abdul Aziz University, and the last one is King Khalid University. For the years of the clinical practice, the responses ranked respectively from the highest percentage of responses, which is 65.4%, and they have been practicing from 1 to 5 years, to the lowest percentage of responses, which is 7.3%, and they have been practicing more than 15 years. In accordance to the educational level, as we see, more of the participants received a bachelor degree, and 50 of them received a master or residency, and 26 of them received a PhD or fellowship, and only one participant with diploma. And more than 2/3 of the participants were dentists. Regarding the inclusion of maintenance of oral and perioral piercing in the undergraduate curriculum, 70.4% of the participants indicated that the maintenance was not included in their undergraduate curriculum. And more than half of the participants never examined a patient with oral and perioral piercing in their clinic. And the majority of participants did not receive a knowledge regarding the oral and perioral piercing outside their undergraduate curriculum. A high percentage of participants indicated that they are not familiar with the instruction related to the oral and perioral piercing and the application of the clinical care regarding the oral piercing when they are encountering a patient with the oral piercing. Almost 2/3 of participants did not have the complication of oral and perioral piercing included in their undergraduate curriculum. As we see here in this figure, it shows the participant knowledge about the oral piercing complication. And as we see here, they have more knowledge about plaque accumulation, recession, and speaking and phonetics, where they are not knowledgeable about the rest of the complications. However, a question was added regarding melanoplakia, which is unrelated to oral and perioral piercing complication, and 43% of the participants did not consider melanoplakia as a complication of oral and perioral piercing. And here it shows the knowledge of the dental profession regarding the complication. And as we see here, the dentists have more knowledge about the plaque accumulation, recession, and speaking and phonetics, and they don't have the knowledge about the risk of complication. Whereas for the dental hygienist, they don't have the knowledge about the complications of oral and perioral piercing. There is a significant interaction between the dental profession and the educational background and the inclusion of maintenance in their curriculum, and the p-value equals 0.03. And as we see here in this figure, there is a huge gap between the dental hygienist graduating from private and the dental hygienist graduating from governmental university or colleges. Whereas for the dentist, there is a slight difference between dentists graduating from private or governmental university or colleges regarding the inclusion of maintenance. But in the inclusion of complication, there is no significant interaction between the dental profession and the educational background and the inclusion of the complications in their curriculum, and p-value equals 0.9. And as we see here, the dentists have more responses regarding the complication compared to dental hygienists. So that's mean the first hypothesis, which stated that there is no statistically significant difference in maintenance knowledge of oral and perioral piercing among Saudi dental clinicians graduating from either private or governmental university, is rejected. And for the second hypothesis, which is stated that there is no statistically significant difference in complications knowledge of oral and perioral piercing among Saudi dental clinicians graduating from either private or governmental university, is accepted. And moving to the discussion, since more than half of the participants received a bachelor degree and only one participant with a diploma, that shows that the Saudi dental clinicians have a high level of education compared to other countries. And for the number of the participants with master or residency or PhD or fellowship, emphasize the need of more postgraduate program for the dental professionals in Saudi Arabia. And as I mentioned in the result, more than half of the dental clinicians never examined a patient with oral and perioral piercing, which may suggest that the oral piercing may not be common in Saudi Arabia, or the individual with the oral piercing may not be aware about the importance of visiting dental clinic for maintenance. So, the Saudi dental clinicians are considered not knowledgeable about the instruction regarding the maintenance, and similarly about the piercing clinical care, also about the local and systemic complications of oral and perioral piercing. And for the can you see the slide? And for the familiarization with the oral piercing maintenance, with the oral piercing maintenance instructions, the dental clinicians were not familiar in general, but the dental hygienists were more familiar about the instruction regarding the maintenance of oral and perioral piercing compared to dentists. And this result can be due to the dental hygienists are more specialized in preventive the oral health compared to dentists. And as we see in the results, the dental clinicians showed a lack of knowledge regarding the infectious diseases as a complication of oral and perioral piercing. And above the mentioned result, a contrasting study was conducted in Latina Italy aimed to measure the awareness of complications of oral piercing amongst a group of adolescents and young Italian adults with intraoral piercing. And the result of that study showed that the individual with the oral piercing have knowledge about the infectious diseases as a complication of oral and perioral piercing. They have knowledge. They have more knowledge about the herpes simplex virus and human immunodeficiency virus as a complication. But here in this study, the dental clinicians were not knowledgeable about these infectious diseases. As I mentioned in the result, there is a difference in between dental hygienists graduating from private and governmental university or colleges regarding the inclusion of maintenance in their undergraduate curriculum. So that's mean that the governmental curriculum include more topics regarding maintenance of oral and perioral piercing than private university or colleges. But regarding the inclusion of complication, there is no significant difference in between the between the Saudi dental clinicians graduating from either private or governmental university or colleges in general. That means they are not subjected to oral and perioral piercing complications in their curriculum, and this led to low response rate of correct answers regarding the complication associated with oral and perioral piercing in this survey. There is a limited published research regarding the dental and the dental hygiene curriculum, or comparing the governmental and the private university or colleges education in Saudi Arabia. Resulting of, this is the first national study comparing the dental and dental hygiene curriculums and comparing between the private and governmental university or colleges education regarding the topic of oral and perioral piercing. Our recommendations is to include the maintenance and the complication of oral and perioral piercing in dental and dental hygiene curriculum to address the lack of knowledge, and to educate the individual with the oral piercing about the complication and maintenance of the oral piercing, and to develop educational programs to the community about the oral piercing, and establish postgraduate programs for the dental hygienists in Saudi Arabia. Also to conduct more future studies regarding the oral and perioral piercing in Saudi Arabia. In conclusion, the oral and perioral piercing require the maintenance to prevent serious complications, either local or systemic complications. And the results from this study indicate that the Saudi dental clinicians are not knowledgeable about the maintenance and complication of oral and perioral piercing, which can be addressed by include this topic in their curriculums, and it is mandatory to aware dental clinicians about their role to maintain the area with the piercing clinically, and to provide proper education and instructions to their patients. Thank you for listening.
Thank you, Ms.Reem, for sharing your research with us. So we are left with 2 minutes, and we will take some of the questions. So the first question is, why did you decide to exclude the students and employed dental hygienists? Can you hear me, everyone?
I cannot hear you.
Can you hear me now?
Yes.
Okay, so the first question is, why did you decide to exclude students and employed dental hygienists?
Why we exclude what?
The students and unemployed dental hygienists.
Because we want dental clinicians who encountering a patient with the oral piercing, and we exclude the student because we was targeting the dental clinicians because they finished their education, and the students they're still study about the they didn't finish their study yet, and this was the reason.
Okay, we still have a minute, so we'll take another question. So what is the prevalence of oral piercing or piercing in Saudi Arabia?
What?
What is the prevalence?
Sorry, I cannot hear you.
Can you hear me now?
Yes, I can hear you. Yes.
Okay, so what is the
yes,
prevalence?
I can hear you.
Okay, great. So what is the prevalence of oral piercing or piercing in Saudi Arabia?
Okay. There is, as I mentioned, there is a limited published research to know the prevalence of the oral piercing in Saudi Arabia, and as I said, maybe there is an individual with the oral piercing, but they don't have the knowledge of the importance of visiting the clinical care, and there is a limited published research regarding this topic in Saudi Arabia. So we cannot know the prevalence specifically.
Okay.
It can be common here in Saudi Arabia, but it's not like in Europe. But that's why we said in our recommendation we need more studies regarding this topic. And this is the first national study comparing about the oral piercing in Saudi Arabia.
Okay, thank you so much. So on behalf of the Saudi Dental Hygiene Society, we would like to award you a certificate of appreciation for your valuable contribution to the conference. So thank you.
Thank you so much.